Welcome back. So Donald, talk to us about the epidemiology model and the ABCs of communication and how that factors into a leader's analysis and evaluation of a situation and how it might be used in a strategic way to do this community systems organizing.
Okay, thanks, Dan. So when we talk about these two, I will use the example of violence prevention because that's, again, where I've had the most experience. But I'm also going to try to talk about it a little more generally so that as you think about the work you're doing, you'd be able to apply it. In public health, there's a classic notion of epidemiology, that what we need to do, if there's a problem, a disease out there, there's three things that we need to do in order to respond to it, both to intervene and to prevent it. The first one is we need to identify what it is. We need to be really clear about what the disease is. The second thing is we need to be clear about the cause of it, what is driving it. And then the third thing that's crucial is to develop and test prevention and intervention strategies, see how those work, and then work to make those work even better to the extent that there are any gaps in there. So I'm now going to apply that to the field of violence prevention. Again, we started this work back in 1990, and the good news and the bad news was there was no book out there that said, here's how you prevent violence. So we really needed to take a model like this EPI approach, and apply it to try to answer those questions. One thing I would just say to each of you as you think about this is that there are often assumptions out there, and there are assumptions that may be spoken and may be unspoken, where we just assume, well, we know the answers to those questions. They're so obvious. I think that to the extent that any kind of problem is continuing to go on, that tells us that maybe our answers to it aren't getting us quite where we want to get to. So in violence, in the field of violence, and specifically family violence, we turned to do the first stage to identify and understand the problem. We actually borrowed from the domestic violence movement and used a definition which says that violence is words and actions that hurt people. It's a misuse of power and authority, and it's any words or actions where the intent or impact causes harm. It's a fairly broad definition of violence. As we look at violence that way, what it starts to tell us is that I think each of us has a tendency to say, well, Dan, you and I are really nice people, and we would never do these kinds of things to anyone else. But if you really listen to the words in that definition, what it tells you is, I believe each of us is capable of words and actions that hurt people. And what it starts to drive is the notion that we're each both capable of being part of the problem, but also, I think more importantly, part of the solution. That second question about understanding and identifying the cause, in the violence prevention field, it's a very contentious question. There are many different answers to that question, and I can't tell you that the answers that we used are correct, but they were answers that we used that drove the work that we created in Ramsey County. We looked to the work of a couple of people. First of all, Rollo May, who was a psychologist and sociologist, who said that acts of violence are largely committed by people who feel a sense of powerlessness in their lives. So in our definition, you heard me say that we define violence as a misuse of power, and then if you add Rollo May's statement, that often arises out of a sense of powerlessness. Dr. James Gilligan ran the Massachusetts State Prison Psychiatry System for 25 years. And he says people will act out violently when they feel overwhelmed by a sense of shame and humiliation. So those notions of why violence is happening, while on the one hand we can't say they're absolutely correct and we know, that they came to us from somewhere on high, they did drive our work. I think that what's important, again, is however you define the cause of the thing you're trying to change, it's really important to be clear about the way you're defining it, because that is going to lead to the way you work to try to resolve the issue and try to both prevent and intervene effectively. Our intervention strategies and prevention strategies based on both that definition and those notions of why the problem occurs, the epidemiology of the problem of violence, led us to take a fairly unique approach, I think, to the problem of violence. And that approach was essentially, rather than confronting people and telling them they're wrong and assuming people are bad, actually assuming people are doing their best, and trying to approach people in a way of removing that sense to the extent that we could in community, that sense of powerlessness and shame. In the next section, when we talk about the Wakainja Project, I'll give you some very, very clear examples of what that looks like. But again, in my more recent work, I've had the privilege of being able to work with baseball teams around the country on the topic of preventing family and domestic violence. And there's kind of two the main approach that's out these days is to say, you know, Dan, if you're a baseball player and you've done something that's not right to your wife or to your partner, I should confront you and get in your face and tell you it's wrong. The approach that we have brought to baseball teams through my work in building peaceful community is to take a little bit different approach and instead try to support and help you rather than confront you. It's a very interesting approach. And again, we'll get more into that with the Wakainja Project. Quickly, I want to then tell you about another very important tool that we have used in our work and continue to use in our work with the Next System Project, which is something called the ABCs of Communication. And the ABCs of Communication actually was taught to my public health colleagues and myself by a person named Dick Wilson, who a local advertising person who wrote the Twin song and was very involved in. He was actually one of Minnesota's madmen, to tell you the truth, and has made his living doing advertising. And he taught us something that, again, sounds remarkably simple. Just like that epidemiological approach, it just sounds so obvious and simple, but it's easy to miss. The ABCs of communication are similarly very obvious, very simple sounding, but very easy to miss. Essentially what Dick Wilson taught us is if you're trying to sell a product or idea, there's three things that you need to do simultaneously in your communication, and they fall into the A, B, and C. A stands for awareness, but it's providing clear and unambiguous awareness of an idea or a product. Now, obviously, if we're trying to engage people to do something, awareness is important, but we must be clear that it is clear and unambiguous. Everyone walking out of the room needs to be wanting to buy the same product, or we have failed in our task. So that clear and unambiguous part, especially when we're talking about changing systems, can be a little bit of a challenge. B stands for benefit, and it's benefit to the person that you're trying to convince. So if we're trying to engage people in violence prevention work, we need to show why it's in their interest to do it. You know, coming and saying, my job is to prevent violence and I'd like you to work with me is probably not going to do it. I need to do a little bit more work on showing you why it's in your interest to be a part of this work. In our case, in violence prevention, in the case of the Next System Project, what does this mean to me? What are we talking about? And why do I want to be a part of it? That's B. And C stands for call to action, providing a clear and doable call to action, giving people something they can do. Once we have done our epidemiological approach, once we've identified this thing that we want to change, once we've identified why we think it's happening, once we've identified strategies, once we've given people that very clear and unambiguous information, demonstrated why they might want to be a part of this, we then need to be able to say, and here's something you can do. Here's a clear and doable call to action that we can measure. And by taking those two things and putting them together, in Ramsey County over these years, we've been able to have some remarkable success in the field of violence prevention that I'll tell you about in a few minutes. And we now will be taking some of those same ideas and applying them to larger system work here at the university.
Great. ABCs. That's great. So your turn. I'm going to task you to work with your neighbor or someone that, or maybe you want to journal your reaction, and I'm going to ask you 3 questions here. What did you appreciate about Donald's presentation? How did it influence your thinking and feeling in regards to issues that you're currently working on? And what would be your commitment to action in terms of taking this information forward and applying it in a systematic way? In just a minute, we're going to talk about how it was applied in systematic ways and what the success was in regards to implementation of this ABC epidemiological approach to change in large systems. See you in a minute.